Yeah.
Hello, we are Team One, and we did our project on ophthalmic implants for macular degeneration. My name is Matthew Casserly.
I'm Zach Siders.
And I'm Allison Smith. Age-related macular degeneration, or AMD, is a disease that impairs and reduces a person's central line of vision by blood leaking into the macula. This leakage occurs due to pressure buildup in the blood vessels behind the eye. AMD impacts a person by causing vision blurriness, cloudiness, floaters, and difficulty adapting to changes in light. Depictions of what a person might see with AMD is shown on the right. This is what would be seen when there's blood in the macula. These impairments affect daily activities and ultimately a person's quality of life. Studies have reported that AMD corresponds to a 39% increased risk of depression in its patients. Age-related macular degeneration affects 11 million people in the United States and approximately 170 million people globally. These people suffer from various stages and types of this disease. Our proposed product is important for preserving an individual's central vision.
So our solution to AMD is an implantable drug reservoir in the macula that releases anti-VEGFs or anti-growth factors, as well as photoreceptor adhesion peptides. So the anti-growth factors bind to and inhibit proteins that promote blood vessel expansion, which keeps them from obstructing the vision, as you saw in the picture on the previous slide. The adhesive peptides RGD and AG73 keep photoreceptors attached to the retinal pigment epithelium, or RPE, which keeps the cells alive and functional. The implant will be made of hema-coated PMMA, which houses both of these drugs that are released. And we chose PMMA because of its mechanical strength, its biocompatibility. It's a clear color, so it won't obstruct vision in any way. And because it is not biodegradable, so it will remain in the eye for a long time. The hema coating also prevents cell adherence and helps avoid inflammation. The reservoir will take about 6 months to fully release its contents, after which time it can be refilled, as you can see in the image below here, through the injection site. So the obvious value of our product is that the implant prevents further vision loss and actively works to improve the patient's vision as well. Additionally, as a one-time surgical operation, most of the price will ideally be covered by insurance. In terms of costs, the procedure itself is invasive, and there's always a risk of inflammation during the surgery as well. So a comparable implant procedure, as well as a year's worth of medicine, comes out to be around $17,000. However, the price of this implant is expected to fall in the future due to competition from biosimilars.
We researched at least 2 existing solutions that help treat AMD, one being intravitreal injections, also known as anti-VEGF drugs, and the second being photodynamic therapy, which is just a combination between an injection and laser treatments. These treatments pretty much are just some solutions that our team wants to improve on. So this is why it would be considered competitors for our design. And on the right, you'll see a table of a 2-year treatment cost analysis for AMD. The highlighted column in green is our intended cost for our implant. And most of the time, these prices are for one eye, but we may need it for both. Aside from this, our solution is preferable because essentially there's no cure for AMD. We want to be able to come up with a product/device that is implanted into the eye, which cures blood leakage and prevents disassociation of photoreceptors, like Zach said. In addition to this, we want our potential solution to be long lasting, since the other 2 treatments we mentioned only last for no more than 2 months. In terms of issues that may arise if our device is unimplantable, there would be simply a continuation of symptoms from AMD, so vision loss, blood vessel growth, etc. And in terms of our target audience, we want to make sure we choose the right people who would invest in our product implant. Some of these people would include eye specialists, eye care centers, etc. And then most importantly, WPI and the VME department, since they're the people who we're actually presenting our design to. And of course, our clients would be individuals affected with AMD. And from research and demographics, our clients would also be people of European background who are 75 years or older. And the reason for this would probably be due to genetics. Here are our references. Thank you.